what I've looked at is, well, whether it works or not depends on what you're trying to do with it. You know, what's the purpose of it? So I've divided it up into two different areas. First one being clinical consultations and the second one home care and chronic disease management. So if we're looking at delivering consultations, you know, substituting, what we're trying to do here usually is take something that you would do in person, like see a patient, and say, well, can you instead deliver that service at a distance? So the research question that you'd be asking in that case is, we've substituted in-person for video, can we deliver this service as well as we can in person, you know? And your first thought would be, well, no, of course not. You can't touch the patient, you can't do a physical examination. There must be some sort of distance between you and... So the next question is, well, instead of just saying, of course not, why don't we look at the research and work out what we're trying to do? There's actually a lot of evidence that you can do an accurate assessment and diagnosis via a video consultation. And not in every area of medicine, obviously. I mean, if someone's got abdominal pain, you have to, or someone has to, put their hand on their tummy. But there's a strong evidence that you can do as accurate a mental health assessment and diagnosis by video consultation as you can in person. And there's also fairly good evidence that you can do aged care assessments and diagnose common paediatric presentations. And this is real time. And then there's quite good evidence that high quality still images of skin conditions are as accurate for dermatology assessments as in person. Which is, you wouldn't have thought so, would you? I mean, there's about an 80% correlation between the still image and the dermatologist doing it in person. But then you say, well, what's the correlation between one dermatologist doing it in person and a different dermatologist doing it in person? Answer, about 80%, you know. So the difference is not significant. But there's some evidence, but there's heaps of different areas of clinical practice where it hasn't been tested. So the answer is we don't know yet. The second arm is what I've called the addition arm, where you're aiming to use telehealth to add to usual care. So the patient's still seeing their GP and their cardiologist and so on after their heart attack, like they normally would, but we've added a telehealth component to their care. So the research question here is, what do you get extra by adding this additional service? Do you get better outcomes? Do you get, you know, less hospital admissions? What do you get? So just to say a little bit about the evidence here, there's been a very big trial of home telehealth in England that's just been published just recently and found reduced mortality and lower hospital admission rates for those three big areas of chronic disease: heart failure, diabetes, chronic obstructive pulmonary disease.